Hello everyone, I'm Godsineze from Nigeria. I would be presenting research findings of a study that was done in Nigeria using text messages for recall reminder systems in routinization. The title of my presentation is Enhancing Routinization Performance Using Innovative Technology in an Urban Area in Nigeria. And well, it would basically show all those findings. Routinization is the cornerstone of primary healthcare strategy. It basically sets the foundation for a child's health, and therefore it needs to be given as prescribed. And one of those prescriptions is that the child should get his immunization within the first year for it to be fully effective. But in Nigeria, like in many other low and middle income countries, there are many impedances to the full performance of routinization. One of them is that children do not present on time. If you look at the screen that's displayed, you would notice that some of the children who have been brought for routinization are way above the 12 months bracket where they're supposed to start their immunization. The other thing is that the session is holding under a tree, and that can be impeded by winds and rainfalls and everything of that nature. In Nigeria, there has been a real erratic coverage for quite a few years, and this has led to pockets and pockets of children who have not been covered. And it's known that when children who are uncovered get to accumulate into a full birth cohort, we begin to have a real rise of vaccine preventable diseases. So we've been seeing such epidemics in Nigeria of late. Diseases like diphtheria begin to resurface, pertussis, and that really affected our interest in doing this study. Again, it's been prescribed that routinization gets to be tracked using home visits. That's really the prescription. But the graph here shows that routinization is not, the defaulter tracking is not really available in Nigeria. You can see that at the onset of the study, less than 1% had ever been visited, and less than 1% had ever received a phone call. So we could say defaulter tracking wasn't available. Meanwhile, this technology of mobile phones is a rapidly emerging culture. You can see that it's spreading all over Africa. And for our study, we had a 95% coverage for mobile phones. So it was like saying almost everyone had a mobile phone. So that made it really easy for it to be used for defaulter tracking. So the objectives of our study were to provide evidence for the effectiveness of SMSs in recall reminder systems, and for reducing dropouts and improving timeliness of receipts of this service, and also to compare cost effectiveness of this mobile health method against traditional home visits, which was the previous approved method. So what did we do? We recruited 905 mother-baby pairs from 8 health facilities and randomized them into an intervention and a control group. Followed them up for 18 weeks, and anyone who got DPT3, which is our indicator for full coverage in Nigeria, anyone who got it before 18 weeks was considered early. Those after 18 weeks were considered delayed. And we sent to do this, the intervention group got SMSs which were tagged the name of the institution for easy recognition. Okay, we had quite a few limitations. One of it was that there were stockouts, incessant stockouts, pockets of stockouts through the period of this research. Also, there was inconsistencies with record keeping, such that sometimes when a mother had brought her child, we got to send text messages to them to remind them to come again, just because the um, the details of their visit were not recorded. Okay, that led a bit to passing the buck. Health workers passed the buck to their seniors, and the seniors passed the buck over to me, and that's created a bit of problem. So, what did we find? We noticed that even though there were these limitations, the intervention group still had a better coverage. The difference was 8.7% between them and the control group, and it was also better than the baseline group. In every health facility type that we studied, which included primary health centers, private hospitals, and teaching hospitals, the intervention group did better than the controls. And well, surprisingly, the difference in effect was much more for the primary health centers and private hospitals than it was for the teaching hospitals. Okay. As per cost effectiveness, reminder systems cost way less than home visits. Home visits in the an estimate for home visits in the first year of implementation cost 3.4 times more than reminder systems using SMSs, which would even include purchase of laptops, setting up a database, paying an engineer to look through those systems. So it was a lot more cost effective. So, seeing that this is an effective method, it's important that we in the low and middle income countries get to consider adopting reminder systems, not only for routinization but for any other service that would require repeated visits to the health facilities. If for any further inquiries, you could send me a mail. Thank you very much.